Hello my friend, first of all I am Dr. Mohammad Shahiduri, MSCOO7 version. Welcome to medical science class. As a student of medical science, I wanted to take flavor every branch of science. What kind of things say do, that is bad, that is knowledge, that is research, that is good, what that is not. As a Muslim, Allah is the one and only creator except Allah, all are creation, last and best Prophet Muhammad. Now my friend about our how much patient? Those that believe me as Dr. Tell. I said with my twinkle solicitor, Ya Alif Lam Lam Ha Illa Shapil Lam Apil medical science class. What is science? Science is anything, any matter, any event, any problem, any inference can solve by logic, document, database, mathematical calculation with provement, with experiment. That is science. What is medical science? Medical science is the branch of science discussed elaborated about homosexuality, like homosexuality, unication. By medical science, creator is one and only already proved. We see in medical science, every patient is death in cardiorespiratory failure. Before that, develop shock. Cardiogenic shock. First, we go to the neurogenic shock. Neurogenic shock developed by neurogenic shock. Neurogenic shock controlled by nerve pain, severe nerve pain, and injury, injurious mediator release from nerve cell. Now we correct that by pethidine morphine, IM. Then cardiogenic shock. Cardiogenic shock managed by if heart rate go to the below 20, then adrenaline, noradrenaline, adrenaline, and above 20 to 40, atropine. Cardiogenic shock, neurogenic shock, cardiogenic shock, then septic shock. Septic shock is controlled by if viral sepsis, antibiotic, if bacterial sepsis, and antibiotic IV, if viral sepsis, antibiotic IV, antiviral IV, protozoal, antiprotozoal IV, helminth, anti-helminth IV, protozoal, helminth. Now sepsis shock. Now anaphylactic shock is controlled by antihistamine, IBIM, and then hypobolic shock controlled by blood transfusion or isotonic solution given if blood is not available. Mismatch cross reaction, blood reaction is correct by steroid and antihistamine. Now my friends, we know that how to manage the as a doctor. If combination of shock, if neurogenic shock, cardiogenic shock, combination of shock, then first try to control neurogenic shock, then cardiogenic, then septic, then anaphylactic, then hypovolemic shock. If combination of shock occur. Now after shock management, if after given medication patient is not feel better, that is that within a if give IV route with after 1 minute patient is not feel better, that still now there is a problem in that. If deteriorated after 1 minute, that is misinterpretation. Okay, fine. Now my friend supporter, you know that we describe elaborated about shock and cardiogenic, neurogenic, septic, anaphylactic, hypovolemic shock and management. What is the sign symptom of shock? Shock, tachycardia or bradycardia, pulse rate above 110, fast go to the above 110. If last stage of ending stage of shock, the bradycardia, heart rate below the 60, fast 40, below the 40, then below the 20, then tachypnea, respiratory rate increase, fast respiratory increase, then decrease, below the 12, then 10, then 8, okay, fine. Tachypnea, then tachypnea, fast increase, then decrease. Ending of the shock, decrease. Heart rate also, bradycardia like 40, then 20. In tachypnea, fast go to the 30, above the 25, 4 per minute, breath per minute. Then 24, 26, 30, and reverse. Then come in below 10, 8, okay, fine, breath per minute. Then you see the cold clammy skin, first sweating, then cold clammy skin, first sweating, then cold clammy skin, sign of shock. Then pulse by pulse rate, by respiratory rate, but by heart sound, you see the heart sound, there is a heart sound. What happened? Heart sound. When you hear the heart sound, what happened? Heart sound, change of heart sound you found. Change of heart sound, if more tachycardia, the heart sound is more. If bradycardia, heart sound is less. In case of bowel movement, in case of bowel sound also, you found the 1 minute, 1 or 2. Bowel sound you found the absence or more, fast absence or more, or reduce. Then pulse rate, tachypnea, skin, so I already said. Then you know that, then the weakness found, the patient lay down, not do anything, not, the jerk movement, knee jerk, elbow jerk, and other jerk reduce or increase. Jerk movement also, fasting reduce or increase. First increase, then reduce. And patient cannot do normal work. Breath rate and severe condition. Face found ill looking, severe ill looking face. By that condition you identify the shock. Now the management the shock. Now my friend and supporter, you know that every patient go to the cardiorespiratory failure. Cardiorespiratory, that is the reason pulse rate and respiratory rate is vital point. At the end of the disease, go to the cardiorespiratory failure and death occur. And cardiorespiratory failure, death occur. And in case of dead patient, how you identify there is a patient? Pupil fully dilated, pulse is not palpable, heart sound is not audible, jerk is absent, and reflex and jerk is absent, respiratory rate, respiratory rate is inspiration, expiration is absent. Then you bowel movement is absent. Also, you found there is no response to sensation, pain sensation, not response to pain in pain, pain sensation also lost. Then, when ECG done, found the straight line. That straight line show the document evidence patient is dead. That is the how you death declaration. How you death declaration the day. And what is the cause of the death? If you take blood sample, if you take